Great. Welcome, everybody. Thank you so much for being here today. I hope you had a great weekend and you're ready to start your Monday morning off with some great information about the Ombudsman complaint investigation process. I'm Alexis Schuman, and I'll be presenting today with Patty Ducaye, our state ombudsman, and Sarah Kimber, our nursing facility ombudsman specialist. I'm ready for the next slide. So today we're going to be covering the important topics of how to not only identify and respond to complaints, but also we're going to be taking you in depth and showing you how to do that so important complaint documentation. We'll start by looking at some sections from the Ombudsman Policies and Procedures Manual, including identification of complaints, timelines to both respond to and investigate complaints, the investigative steps of complaints, and then we'll also move on to look at the past 10 years trends in ombudsman complaint data. And then really that show and tell portion where we'll walk you through how to properly document your cases and complaints in the ombudsman database. We'll also have probably a good amount of time for some questions and answers. So as we're going through, if you have a question, feel free to either raise your hand or utilize the chat box, and we'll be monitoring that and either answer your question, right there, or save it for maybe a place that we might be talking about that subject a little bit later in the presentation. So we are, here to be interactive and talk with you all. So please feel free to use that chat box to let us know what's on your mind, and certainly if you have any questions, that's the best way to get our attention to it. We are going to start with a poll, and I'm going to launch it real quick. As you can see, we are asking yourself to rate yourself. How great is your documentation? Oh shoot, this poll, I've got my other two polls, but not this one here. So I'm just gonna type this out real quick and I'm going to memorize these numbers because I'm going to do it a little bit more amended. Sorry about that. Okay, so 1 through 5, 1 being the worst, 5 being the best. How great is your documentation? And here we go. Launching. So again, if you can't see the slide there, 1 being the worst, 5 being the best, rate yourself. How would you say you do at documenting your cases and activities in WellSky? And it's anonymous, so feel free to be honest. All right, I think that's been a good amount of time. Let's go ahead and look at the results. And I forget if you guys can see them, so I'll tell you what I'm seeing. We've got about 7% who said 1, not great at all, 20% who said 2, kind of a little great, 35 at 3, which is kind of great, 36 at 4, which is pretty great, and only 2%, y'all are so modest, are saying you guys are amazingly great, doing everything perfect. So mostly 3s and 4s, which is totally understandable, and hopefully by the end of this webinar, we'll get you to bump up at least one number. Let's go on to the next poll. So this one is asking you to tell us how frequently you enter your case documentation in WellSky. Are you an everyday person? Are you a multiple times a week person, a once a week person, or a once a month person? Launching now. Give it just a few more seconds here. Hopefully, this is a quick one to answer. Okay. The results I'm seeing actually are surprising me a little bit. They keep coming in, but it looks like about a third, well, now it's closer to a quarter. About a quarter of people are saying they document about once a month. And so we'll talk about that and how that'll need to change upcoming. And we're going to ask you to be documenting more frequently. But this is helpful for us to see. And it may be that we've got some volunteers joining us, and that'll stay at a once a month um, frequency maximum. About 20% say once a week. The highest number is 32%, more than once a week. And every day, real rock stars is about 18%. So thank you for answering that. All right, those are our two polls for now. We'll move on to some content. I want to start the presentation by just reminding us that investigating complaints on behalf of residents is truly the core function of a long-term care ombudsman. This comes not only from our federal law that authorizes us in the Older Americans Act, but it's also represented in our state laws and our policies and procedures. And hopefully this makes sense to you. The whole reason for us, for long-term care ombudsmen, is so we can be there to help identify, investigate, and resolve complaints on behalf of residents. And importantly, not only do we need to identify complaints, but we need to be able to show our work through documentation. We know you're out there working so hard and doing great work, and we know that long-term care residents face significant challenges. But we cannot share this story if we don't have documentation to show the reality of what life is like for residents of nursing and assisted living facilities. For example, if we are speaking with the public or with long term care regulation, or if we want to go testify to Congress about how the problems we know we're seeing, staffing, poor care, residents not having enough money for their personal needs allowance, if we can't back that up with complaints from ombuds manager, from well sky, that's going to be a really difficult thing to advocate for. Um, you are telling the resident's story not only when you're helping them investigate these complaints, but also when you're putting that information into Well Sky. If we hear from you weekly, daily, how bad things are you're seeing out there, but it's not reflected in the database, that's going to be a difficult thing for us to talk about and advocate for. Also, you never know when you might need to have those details from a case. All the time, we get residents who come back after weeks or months and have a new complaint or a complaint related to some work you've already done. And if you don't have your story and your work in the Ombudsman database to show what you did and what the steps you took, we're kind of starting from a place where we're not getting the full information about what we've already done to help us best serve the residents. And again, it also happens that sometimes a resident will come back or a family member will come back and dispute something that you've done. They'll come to your manager or come to the state office and say, I called them on this date and they didn't do anything. And so if you haven't put your work in the ombudsman database, it's hard for us to say what did happen. Those are not the best fun situations, but they certainly happen, and we expect that they'll happen. And the best way to be prepared and show your work and what you've been doing is to document. Again, your work and the resident story don't get told if you don't document. It really, really does matter. And that will be a theme of this presentation. We're going to move on now to some language from the Ombudsman Policies and Procedures Manual. You all know that I'm fond of it and I'll talk about it often, but that's because we've put so much work into making it comprehensive and helpful and available to you to answer a lot of these questions about how to be an ombudsman. On these next slides, you'll see in the upper left-hand corner the exact section of the Policies and Procedures Manual that we're getting this information from. So you can always go back and get more information. We won't go through it all, as well as if you have questions or you want to refresh, great place to go is right there in the Ombudsman Policies and Procedures Manual. So these are the Ombudsman complaint fundamentals. They apply in every situation, and when you're in doubt, if you come back to these three fundamentals, you can usually kind of see a pathway out of some of the stickiest situations. The first one is that a local ombudsman entity, your organization, must ensure that certified ombudsmen identify, investigate, and resolve complaints on behalf of residents, what we just talked about in that past slide. The second point here is that we must always work on behalf of a resident. I know sometimes when you're in the midst of a complaint, it can get so complicated and you're wondering what to do next. And it's sometimes easy to forget to take a step back and remember, what does the resident want? What's in the resident's wishes? And if the resident can't communicate those wishes, what have we looked at to determine what the resident would have wanted or who the resident chose to make decisions on their behalf. Last one here, hopefully you guys are all utilizing this one. When in doubt, when you have questions, please consult with your managing local ombudsman or your supervising staff ombudsman or us here at the office. We are here to assist you, and our goal is certainly to help you through all situations, big or small. And we hope that you'll never be shy about reaching out to us when we can be helpful to you. Moving right along. Now we're going to talk about what is a complaint. So as you can see, there is an actual definition of a complaint, which is a complaint is a statement of dissatisfaction or concern made by or on behalf of the resident that relates to action, inaction, or a decision by any person or entity who provides care or makes decisions related to a resident that may adversely affect the health, safety, welfare, or rights of the resident. So it's interesting. I think a lot of us kind of have an idea of what a complaint is, but maybe don't come back to this definition of a complaint. What I like about this definition is it does include so much and it's broad enough to cover all the work that we do, but also helps us funnel things back to that concept of, does it impact a resident? Is it something the resident wants? So for example, a complaint doesn't have to be complex. A resident who tells you they don't like getting up so early, that's a statement of dissatisfaction made by the resident related to their well-being or rights. So that's a complaint. A complaint, that what is helpful to remember is that the complaint does have to be about a resident. So sometimes, as you all know, we'll have a staff person call and say, "Gosh, my boss really treated me badly," or we'll have someone from the community call and say, "I've got a complaint about my home health care agency." So those are things that are information and assistance, but because they're not about a resident, they are not a complaint. And I'll put in another plug for the Policies and Procedures Manual, which has tons of examples of both things that are and are not complaints. I have been neglecting the chat. Let's see. I don't see any questions yet, so I guess I haven't been neglecting it too badly. And we can move on to the next slide, please. We're moving on now to talk about the ways to respond to a complaint. Hopefully, you all know this is something that I think a lot of people have in their minds, this 2-day timeline. We as ombudsmen are required to respond to a complaint within 2 business days if the complaint is not related to abuse, neglect, or exploitation, and within 1 business day if the complaint is related to abuse, neglect, and exploitation. And you'll remember that if it's related to abuse, neglect, and exploitation, then we need to respond with information about the investigative authority that determines whether or not abuse, neglect, and exploitation happens. So if you get a complaint that says, my mom lives in a nursing home and she's being abused by a caregiver, we need to let them know that we will assist them, but we're not the ones that investigate and determine whether or not abuse happened. Here's the number for complaint and incident intake. This is stuff, again, that hopefully you're familiar with. But one thing that we wanted to highlight is that a complaint response does not mean that you have to resolve the complaint within 2 business days or visit the facility within 2 business days. A complaint response is acknowledging the complaint, letting the complainant know whether or not it's something that you as an ombudsman can help with, and it's kind of starting the process. We know that some complaints may take weeks, if not months, to investigate and resolve. So wanting to clarify, because sometimes it does get a little confusing, that this timeline to respond to a complaint does not mean you need to have it all wrapped up and done within 2 business days. Um, so a complaint response may be replying to an email within 2 days, returning a voicemail within 2 days, or you may be responding immediately in person. If you get a complaint while you're out there visiting a facility, your response might be right there on the spot. Oh, sure, I can help you with this. And then you start moving into actually working on the complaint. We'll move to the next slide. I'm going to take a sip of water. Okay, so we have determined that we have received a complaint. We've responded to it within 2 business days. The next step is to think about whether or not a facility visit is required in order to investigate a complaint. I'll point you again. This is an OPPM, the Ombudsman Policies and Procedures Manual, Section 730. And we wanted to go over this section because, like the 2 and 1 day response time, we have gotten some questions that people let us know that maybe it would be helpful to have some more clarification on these concepts. And the kind of thing that gets confusing here, I think, for some folks is remembering that you may have a complaint that doesn't actually require an in-person visit to the facility. So we're asking you to use your professional judgment, your ability to prioritize your knowledge and your history of the resident and the facility to make judgments about if a visit to a facility is needed, and if so, how soon a visit to a facility is needed. And the language that we have in the Policies and Procedures Manual is there to help you make those decisions. So let's start with when and if a facility visit is required. A facility visit is required if you need to go in person, either to get consent from the resident or to investigate the complaint in person. So if it's a resident maybe you don't know well, who can't really speak on the phone or other virtually, then you'll have to go to the facility to talk with them and see what their wishes are, if they'll give you consent to work on the complaint. The other piece of that is if the complaint requires some sort of in-person investigation. Maybe it's a complaint about conditions of the facility, or it's a complaint where you're going to need to get records and you don't think the facility is going to be able to, send those electronically to you. If either of those apply, then you're required to visit in person. Of course, this means that not every complaint will require an in-person visit. For example, some of us have residents, probably many of us have residents who call us quite frequently. We know them well. Maybe they have kind of similar complaints month after month or day after day, and we've already really worked those complaints, and we feel that the facility is responsive to those complaints, and maybe the complaints aren't even verified, but it's something that the resident likes to call and talk with us about. If that's the case and you don't feel in your professional judgment that a visit is required to investigate that complaint, it's perfectly okay to do what you can to investigate the complaint. Over consent can be got over the phone. Sorry, I got distracted by the question. Great question from Miguel. Consent can be gotten by the phone. That is correct. So if a resident is able to communicate with you over the phone, then that is perfectly okay to get consent over the phone. And that would be a way that maybe you could handle the entire complaint over the phone. The example that I have in my notes here is, say a resident that you know well calls you and says, "Hey, I've been trying to get an appointment with the social worker for a month and they're not coming to see me." Well, you may be able to just call the office and say, "Hey, what's going on? Can you make sure to come see this resident?" And if they're able to go do that, and you can call the resident to confirm that the social worker went and had their appointment with them, that's a whole complaint that you were able to investigate over the phone. So great question. Thank you, Miguel. So let's talk about the opposite side of that coin. You've determined that you do really need to get to the facility either to get consent from the resident or to investigate the complaint. We give you some guidelines for determining when and how quickly you need to get to the facility to investigate the complaint. You will, like I said, have to really use your judgment on some of these. They're not, an exact, every situation is going to be different. So these are to help you determine which timeline applies. So the first timeline, the soonest timeline is 2 days. And this timeline is if there is some sort of risk to the resident or to evidence if you do not visit quickly. This may be a facility calls you and they're going to immediately discharge a resident. And you, by visiting the facility and intervening, you could benefit the resident. Or you're concerned that maybe some records will disappear or the conditions at the facility might change. Or if a resident calls you and they express that they're concerned about being physically or psychologically harmed. That's our fastest 2-day timeline. And, hopefully that makes sense that we want to get out there quickly to address and support the resident and to address the complaint. The next timeline is 10 days, and that is if there is no risk to the resident. So you still need to go out to get consent from the resident or to investigate the complaint, but there's not really going to be an added benefit to the resident if you get there two days earlier, or I'm sorry, within 2 days. Um, and it is okay, and it's not going to be harmful or a risk to the resident if you wait a little bit longer. Now, this last bullet here is again to kind of help you prioritize and plan your own schedule. You know your residents best, and there may be situations where you don't need to go out there until your next scheduled visit. So maybe you've got a visit coming up in 2 weeks. You can let the resident know, and we encourage you while being responsive and responsible to residents, to also be able to manage your own schedule and set up reasonable boundaries when necessary. So again, maybe you've got a resident who really calls you often and you know well, and perhaps it's the same complaints you've heard before, and you think and you know that the facility is being responsive and caring to the resident. And you can say, Mrs. Jones, I'll be there on my next visit, and we'll be able to discuss these complaints then. We can move on to the next slide. Okay, I only have 2 slides left, so I'm sure y'all are ready for a change of voice, but we'll make it through these next couple ones. We've got here the steps of complaint investigation. I'm a broken record. I will say again, this is very condensed. There's a lot more step-by-step instruction in the Ombudsman Policies and Procedures Manual. First up, as you all hopefully know, the ombudsman must always seek consent from the resident or determine if you can act without consent. We've covered this topic quite a bit in other webinars, so we're actually not going to dive into that today. But if you've got questions about it, please come to us or remember to go back to the Policies and Procedures Manual. Um, Part of seeking consent is to determine the resident's wishes and to the maximum extent possible encourage participation with the resident in the complaint. So we want to encourage that self-advocacy and that self-agency. So see what the resident can and wants to do to be their own voice and to help solve the complaint on their own. So that may be the resident wants to be a part of reviewing records with you. The resident wants to be a part of you talking with staff. Make sure you're giving those opportunities and explaining to the resident the plan as you're going along. The other thing that we'll have to do as ombudsman is to identify applicable laws and policies. This may be just something that you already know. So for example, resident has a complaint for you about their shower time. You may know in your head that the tax says the resident has the right to choose their own schedules and make choices and participate in their care. But if you're like me, every time you go back to the TAC or maybe a provider letter or the federal regulations, you learn something new and you see something different. So even if it's something simple, it's a good idea to refresh yourself. Go back, look at the TAC, what rights, what laws, what policies apply. And then, of course, depending on the situation, you may, as part of investigating the complaint, need to observe the environment. You may need to conduct interviews, review resident records, or request assistance from other appropriate entities. For example, long-term care regulation, Texas Legal Services, a local authority, etc. And those all steps, you should be getting consent from the resident and make sure that they're on board with those steps and they know what you're doing and have given you the go ahead to take any of those steps. And finally, you'll see underlined and bolded here, a reminder that documentation is a step part of complaint investigation. It's not a separate thing. It's not that you investigate a complaint and then documentation is this different thing. Documentation is part and parcel of our complaint and investigation process. Bit more about that on my next slide. Great. So you've heard me say it. You know it. Every complaint must be documented in a case. As Patty and Sarah will show you in the upcoming slides, documentation must include an intake, consent, or whether or not consent was not needed because we have authority to act without consent. For example, if it's a complaint that affects multiple residents or the resident is unable to consent. Verification, whether or not the complaint is generally true and accurate, the actions that the ombudsman took to investigate the complaint, and the disposition. So how satisfied is the resident with the work that you did and the resolution of the complaint? Someone else, and I should have highlighted and bolded this too, somebody else must be able to tell what happened when reading your documentation. So like I said in one of my earliest slides, it really needs to stand alone. If somebody who did not work on the complaint is unfamiliar with it, should be able to read it and know what the ombudsman did, what the resident wanted, what happened, and not be confused on the steps that were taken. I also alluded to this earlier when we were doing our poll, and it was 25 to 30% of folks saying that they were only entering their casework monthly. For staff ombudsmen, so for volunteers, this isn't changing, but for staff ombudsmen, our current draft of the Ombudsman Policies and Procedures Manual that's out for review right now, and we're, you know, we're confident that it's going to stay this way. We are going to be changing it so that there's a 14-day deadline for staff ombudsmen to enter their work in WellSky. So, hopefully this won't be too much of a change for many of you. And really, I think it's a pretty fair minimum of data entry, especially when you know how much information and memory and detail gets lost if you wait longer than 2 weeks to enter your documentation. You could have the greatest memory in the world, but if you're waiting more than 2 weeks, details are certainly going to get lost, and maybe cases aren't going to get entered at all. So that will be coming up, and we'll be doing, I'm sure, more training about the changes to the policies and procedures manual as we go along. And I'll stop there and go ahead and pass on to Patty.
Hello, good morning. Thank you for being with us today. Yes, so transitioning over for a few minutes with me, I'm Patty Ducaille, your state long-term care ombudsman, and I will be spending just a few slides of content and then spending some time in WellSky for training. So I'm going to show you cases in the database we use. So again, to any volunteers who may be listening, we're excited you're here. Don't be scared off by this information because you are not required to enter into WellSky. In fact, volunteers are actually prohibited from entering into WellSky. We only give that access to our staff ombudsman. But volunteers who are watching, you can learn something about the details that are collected in our database so that you see why the information you're asked to give on the volunteer form is so essential and how it's used and why a staff ombudsman may call you and ask questions if there is something incomplete that they can't fill out in our WellSky database. So WellSky is the brand name. I'll probably use it and Ombudsman database, maybe interchangeably. I am very happy to be with you today. Thank you for joining this important conversation about why your investigation needs to be thorough and why it needs to be documented as thoroughly as it is performed. And I'm going to be switching back and forth between screens, so forgive me if I have a little bit of delays on my process. I'm managing what's being seen today. So first off, I want to spend a few slides just showing you some information about our work and what information has been reported and recorded over the years. So here is a look back at 2012 all the way up to 2021 or 2021, and you can see where things have dramatically changed and shifted for our work. So the first column is the year that we're reporting on, and that's a fiscal year we're using, state fiscal year. So September 1st through August 31st of every year. NF complaints, nursing facility. ALF complaints, assisted living facility complaints. And then ACOs stands for Active Certified Ombudsman. So that's the number of ombudsmen, a collection of both volunteers and staff ombudsmen who have reported any casework or who have worked throughout that year. So one of the first things that you might really notice here is how everything is just this decline. From 2012 to last year, just a steady decline in some ways of the active certified ombudsman number, but a consistent one. And we know there are many reasons for that, and there are different reasons over different periods of time. We've had changes in our policies for the ombudsman program, and who can be an ombudsman has changed over years so far back, 10 years ago. And also the pandemic has obviously really affected the number of volunteers that are in the program. As we have fewer volunteers, the workload really shifts to the staff ombudsman. But also take a look at those nursing facility and ALF complaints, and you'll see a real dynamic change, a steady decline in our nursing facility complaint codes, year after year, essentially a decline over the years. ALF complaints are a little different, a little funnier. There is new funding that got infused to the program kind of midway through this 10-year period that we're looking at, and that can offer some explanation as to some changes. But you can see that after that money started to be infused into our program, we then are steadily declining with our complaint numbers. Another thing I'll point out here is just the dramatic difference between the number of complaints we have reported about nursing facility residents versus assisted living facility residents. And yet how much of a difference there is now. It's actually, I mean, 1,200 complaints last year for assisted living is a very small number of complaints statewide. So it's a little hard to measure these things in the last several years because those complaint numbers are so low. But to see them be, 25% of all complaints when there are about half as many assisted living residents as there are nursing facility residents, you might expect to see more of a comparison of 2 to 1. And here we have more like 4 to 1 in terms of nursing facility to assisted living facility residents. Just going to show you a few different ways of looking at the same information. So I'm going to move along to some other visuals here, and you can see a linear path, a line graph showing you the nursing facility complaint numbers and the side by side with the assisted living facility complaint numbers. Remember again, around 2016, we infused new money into the Ombudsman program statewide that continues at the same amount. For us, 2016, actually, we added some money a couple of years later. That shows that increase in complaint numbers in the beginning. It doesn't quite explain when we have money still coming in at even a higher rate of 2016, why our complaint numbers are really dramatically lower in our assisted living facilities. And you can see that massive drop off in our nursing facility complaints. One other thing I'll acknowledge is that we have had a change in our complaint reporting in 2019 at the end of 2019. So the last 2 years of our work, we are all working under a new set of complaint codes. And those codes are now about half as many as we had before to choose from. And that has seemed to affect reported case numbers and our complaint codes that are recorded within those cases. But I will tell you something, while we in Texas saw a dramatic decline in our case numbers reported that first year, there are other states like California that actually saw an increase in complaint reporting in their state. So having a different set of complaint codes does not really seem to be a reason why we had such a change in the number of cases and complaints that we reported. One more visual for you to take a look at. On the left-hand side is showing you the number of complaints that we reported. The purple bars are our numbers of active certified ombudsmen. Again, that's volunteers and staff. Green or turquoise is our nursing facility complaint numbers, and that orangish line is our assisted living facility complaint numbers. So it's not an one-to-one change here with a decline in volunteers, because we know our staff numbers have stayed pretty steady. We may have changed staff, so new staff have certainly come in and more experienced staff have left the program. But it is obviously the number of active certified ombudsmen is really a reflection of volunteer losses. And so you can see there's not a one-to-one effect with that either. So I'm going to move away from data and ask you, before I do that, just to check in with you if you'd like to chat a question, because I won't be talking about statewide complaint data. for the remainder of my section. So if you want to ask me a question, could you put that in the chat? And I'm just going to hold for just a moment to see if anyone wants to ask me a quick question. And I'm going to transition over to WellSky in just a few minutes, so be ready for a little bit of a visual change. And it's going to be a little tricky to make our WellSky database visible to you all, so I'll also work to kind of blow that up for you and make it as easy to see as possible. So I don't see any questions coming through the chat now. We can certainly come back to questions about our statewide data in very soon. So I'm going to ask you on this first case, it's called bad case, just to help me find it easily in the system. I want you to give me some feedback. So get ready with your chat responses, because I want you to say things that you see in this example and tell me what you see that you think is wrong, poorly documented. The point here is for you to see what we see sometimes, and when we look at case records and how they need to be improved. So again, I'm going to get us into a case record. And I do have the WellSky database pulled up here, so I'll ask one of my colleagues in the state office to let me know if this is not showing for any reason. And right now I'm having a little trouble making it work. I'm going to turn off my video, see if that helps in any way. It does not seem to be helping. My backup plan is going to be to go to Pat's presentation if this doesn't work well. So I will go to that if we can't do things successfully here. I've got it showing now, so I'm going to make this bigger just so it's a little bit more visible. I know this isn't going to be perfect in terms of your visibility here, but I'll do my best. And now I can see it on the screen and hope that's true for all of you as well. So first up, I'm just going to show the top of a case entry. This is after I've initially started that case record, right? You've got a little pop-up that comes up and you can put in a few details, hit OK, and it starts your record. Well, here I am after that point, and again, I've labeled this bad case. And I've given it a reference title. Can I ask you all to tell me, give me some feedback about this reference title here in the chat of our Teams meeting, please. Comment on use of resident rights as my reference title, please. What do you think about that? How will that be useful to you? Apollonia says it's too general. Susanna says it's not really accurate. It's not even a rights issue. And Carrie says it's not specific to the case. Great. There are more comments that are going to come in, and I appreciate you all taking the time to do that. And I'm seeing some themes. Good comments here. So everybody should read what's happening in the chat, because they are saying the right things about the use of the term resident rights in this reference title. It's generic. It doesn't really match with the actual problem. So really important for you to pay attention that even your reference title matters. And I see some pretty generic things, and then I see some really good, simple, few word descriptions that may look like something else you work on in the future or in the past, but they can be helpful to you as you're looking for a theme and you're coming back to look at this. That's what a reference title is for, is to help you. So you can see this has been assigned to me. I've got my intake initials that immediately go in. I've got a date opened, and you see that I've documented that my first action is on that same date. So we'll need to pay attention to those two dates. I have marked consent obtained here, so I've checked the box in the far right-hand corner. And then let's take a look at your intake summary now. So focus in on what I've said about this intake summary. Residents unhappy with cold food that isn't what he ordered. Says, quote, "It happens all the time," end quote. Dietary manager explained there is a new ordering system and there are kinks. Resident okay with explanation. I'd like to ask you to comment now on what do you see in this intake summary? What comes to mind as not good documentation? Because you know I've said this is a bad case. Tell me what's not good about this intake summary. Emily comments that some of it looks like it's more of a journal entry. I agree. Grammar. Okay, Liz. I'm less of a grammar hound when it comes to the documentation here. It should make sense, but I think what I will acknowledge is that there's not always a clear subject and verb in the sentence, or it's just sort of generically written, and I think that's not as helpful as it should be. I'm reading through comments, chats. An outcome should not be included in the summary, Yvonne says. Agreed. Agreed. It's really like this is what the ombudsman reporting is saying, everything that happened right here in the intake summary. And I will say we see this quite a lot, and that is the wrong way to be documenting this. An intake summary should be, what did you hear about? That was the initial description of the complaint. The other thing an intake summary should do is explain who has consented and to what. Certainly, if it's not clear who has, if someone other than a resident has complained, you need to be specific about who gave you consent to work the complaint. And then we'll talk about some examples of how that gets documented based on what the resident directs you to do if you've got a complainant other than a resident. Susanna says the info from the dietary manager should be in a journal. There's no times mentioned. There's nothing specific enough about what the problem is with the meals. Iris says the response from the dietary manager is not the focus of the complaint. So I think what she's pointing out is it doesn't really seem to address, certainly not enough specifics to address, that the resident has talked about getting cold food. Apples is pointing out that she doesn't see the name of the resident. And Miguel makes the point, I think, that I was trying to make earlier, that it's kind of like everything gets dumped here in the intake summary, but it sure isn't much and it sure isn't enough detail. Well, I'm going to scroll down and show you something else I see quite a bit. Take a look at this one journal entry. That's all there is. So we're looking at kind of the entirety of the complaint journaling. This is an exact copy of what's in the intake summary. And this is my lesson number one to you all today. This is something we have seen all too many times in WellSky. There is kind of a dump of a case in the intake summary copied over into a journal entry as if that's meeting some kind of documentation requirements. It is not. When there isn't enough information, first of all, it's just not helpful to copy something into two places. Why would you say the same thing twice unless you're going to elaborate on it? So don't do that. It's not really a good use of your time, and it's not meeting the documentation requirements. But secondly, we've got to have some explanation here that makes sense. This is so ancillary and superficial in terms of what you're providing to us to explain what problem there was and what you did about it. So be sure that you are really explaining enough that there's something I can tell that has happened and that it justifies that this is something that an ombudsman actually worked to resolve. Lisa says that the intake summary lacks information about who, what, when, where, and how the problem or complaint was dealt with. Excellent feedback from Lisa. Those are the kind of fundamentals of documenting a situation that we work on: who, what, when, where, and how, when possible. Now, sometimes not every single one of those questions can be answered, but it's a really good policy to apply to your case documentation. Deborah asks if there is any time spent. We don't see any time spent entered in this particular item. Good point. The subject, let's take a look at the subject of this journal entry. I've put resident's complaint. What do you all think about that as a subject for what's written here? So I'm asking again for your chat comments about the subject that I've chosen to use for this journal entry. Okay, Carrie thinks there should be more description in the subject line. The subject line should tell you what to expect in the journal entry. And in a way, this isn't too bad, given how bad our journal entry is, but we can always do better. What would be better is to have other journal entries that really describe that conversation with the dietary manager. When did that happen? Who did you speak with? Who is the dietary manager? What did you discuss? What's this new ordering system that he or she mentions? And what are these kinks that have been experienced by the staff in the facility? That would be helpful explanation that helps you know what solutions there are to be approached with the facility and what could be explained to the resident. And then the resident okay with explanation is some meager attempt here in my made up example. It's a really meager attempt to explain that this problem was resolved, but it sure doesn't say how you explain this to the resident. When did you explain this? We can assume it happened on the same day that you were there, but that demonstrates to me that you didn't do any kind of follow-up in this particular case to see what effect this explanation from the dietary manager had on the resident and cold food, right? The goal here is we get a complaint that has a meaningful, lasting solution to the resident. And while some complaints can be addressed in one day, I acknowledge that. Most complaints should not be addressed in one day. That means completely resolved, finished, because most complaints need some backup, callback, observe, be in the building, whatever it is that you need to do to follow up and see that whatever solution was proposed has actually been implemented and that it's happened more than once. And that's how you check resolution and satisfaction from a resident or any other complainant in a meaningful way. So last thing, I'll peek right back up to our complaints. I just wanted to show you here. This is the screen for your complaint entry, of course, and I selected one complaint code here to represent food services, which is the accurate complaint code under the circumstances of cold food being delivered. And you can see that I've chosen to open and close this on the same day. I've said it is partially or fully resolved to the satisfaction of the resident, and I've said it's verified. You have to have these elements. You have to have a disposition and a verification in order to close a record. And we've put these things here, but what justification do I have for those decisions in a journal entry? So I'm going to cancel out of this guy and find my better case. So let's make sure I get to the right one. I'm going to open this. And I want you to know that in the second example, what's considered my good case, that I have taken this from a real case I worked and moved it here. I did not edit it except to change the name of a resident. So I'm being real with you here. This is how I actually documented a case. I'll let you know that when I answered the survey question, the poll question at the beginning of today's call, that I answered that I am number 4. I think I've got room to grow in terms of my case documentation. But here I will say this is to me a good case if I looked at it from the perspective of looking at one of your records. I've got a reference title that talks about a holiday meal. It references the sun in this case, and so there's something here that really triggers a memory for me and helps me understand it. You can see my date opened and first action, and then that I've marked consent obtained. In my intake summary, I mentioned here that during a resident council meeting, a resident asked if her son could join for a meal on Christmas Day. The activity director told all residents, this is in the resident council meeting, that they could not have a visitor. Because I was attending the meeting, I voiced that visitors were allowed, and I would discuss this with facility management. This is an event where in the middle of a resident council meeting, it wasn't residents bringing a complaint out in the middle of it. It was identifying a complaint in the middle of a council meeting by me. And I wanted to be sure that residents understood that they could have visitors. This case has been closed. This complaint has been closed. And I'm going to take a look. I chose to mark this as a visitor complaint. You can see that I had just a few days, about 7 days, when I opened and closed this case. I have marked it as fully resolved, partially or fully resolved, and verified. I personally observed the staff inform residents they couldn't have any visitors in the building, and I knew that was incorrect. That is my method of verification there. Now I'm going to show you some journal entries, and I hope you'll see that these aren't necessarily complex. This isn't necessarily complicated documentation, but it tells you the story of the actions that I took. So this first one, I will open. And this is an explanation of my complaint investigation. So you remember I got the case in the resident council meeting. This is a subject of spoke privately with Ms. King. So this is the conversation I'm documenting about what she had to say about wanting her son to visit on Christmas, and my description of what the conversation that we had. I'll let you all comment in the chat about things you see, things that you think are imperfect, or things that you think do a good job of explaining what I've said this subject is. So you're welcome to speak up in the chat as you notice something, and that will help others react and respond to this as well. So I give a little background about this relationship with her son and her son's status of having a disability as a factor in this request, and also that she shared information with me about the loss of her husband. So here I describe consent. I asked for her permission to discuss this with management, and she said that I could. So consent can be described in this way and many other ways, but I'm speaking directly about this resident. And I told her I would visit that so that I could confirm that the issue was settled and that make sure that she was allowed to visit with her son on Christmas Day, which is what she wanted. So I'm going to move on to the next complaint, the next journal entry, which is labeled discussion with SW, social worker, that's going to be slow, activity director and director of nursing. And so this is the conversation that I had with these folks. And here's where I found out what the requirement was, where I could state any concerns about what the facility policy was, and the DON, the director of nursing, Georgette, explaining that they could in fact have a visitor, but it would need to be visiting in the residence room due to, in this time, COVID status and vaccination status being unknown. So this is a couple of months ago, and things are always changing in terms of CDC policies. Here I've described what I did. I asked for a request because of the son using special transit. I've asked for a request for the facility to be able to provide a meal to him if that is what the resident and the son would like to do, and that's agreed upon. So that's exchanged here and described. I also mentioned that the resident had experienced a loss a year ago and seemed to be grieving. And then I described that the social worker has acknowledged that he will speak with the resident and make sure she understands how this visit could occur. So that is all described here in this journal entry. There's an email exchange that I have with the social worker, Chris, and that is just copied and pasted in here. So this is perfectly okay to do as a journal entry, but you do need to have a subject that tells me what I'm looking at. And your email exchange needs to be logical enough that someone can read it and understand what it is that has been learned from or gleaned from this exchange. I do tend to include emails into my case records, and I see a lot of you doing that, and I encourage you to do it. Make sure that you either describe that email at the top of the journal entry and in the subject line, or if the subject line is sufficient, you can use that to describe it. I'm going to turn and see that Carrie asks, would you put time spent for emails? It takes time composing and reading. You certainly can. I felt in this example, I had not done that, and I wanted to leave it as 0 because it didn't take me much time to convey what I wanted to and to notice the response from the social worker. So in my case, it wasn't really 15-minute worthy, and we use 15-minute increments as sort of the status check for whether something is, to me, worthy of reporting time spent. And then the last one is a visit back to Miss King. So here's an explanation of me going back to see Mrs. King or Miss King and talk about her plans for Christmas and what she wants to do. She acknowledged that the social worker did speak with her, and she has indicated that she's capable of calling but hasn't connected with her son and stepson. She has kind of a plan that her stepson will help with transporting her son here, or maybe she'll even go have a meal with him. So ultimately what happens in this situation is we agree to go down to her room, and she gets my help to call her stepson, and they actually connect, and so I leave the room so that she can proceed with making her plans, but that we confirm the facility's interference or disruption of her right to visitors has now been addressed. So with this justification of these 4 journal entries, there is reason for why this is marked as partially or fully resolved, because the barrier from the facility has been removed by my efforts. I will say that my journal entries are not perfect. Nothing has to be perfect or can be, but they tell a story, and you could read this whole thing, and you have it as a handout. You can read the whole thing and you can figure out what I did, what steps and action I took, who I spoke with, and when. And so that's what we're looking for. Nothing has to be too fancy, but it has to be there. There has to be enough for us to make sense of what the work that you're doing. Okay, I'm going to come back to my slides here and quickly say a few things. Here's a reminder of the holiday meal, the good case example that I just provided you. And I want to say 2 more words on 2 slides about volunteers here. First, a case for a volunteer has to meet the definition of a case and include ombudsman investigation and follow-up. We recognize that a volunteer's record keeping may not be, probably won't be that as detailed as what a staff ombudsman may be documenting down the road. Sometimes it is, and we welcome that help and that good documentation from every volunteer. But we know that if they're using the activity report each month, there's only a few things in there that are really, there's not a lot of space there, and so you may get a more summarized version of the complaint. But that activity record actually includes all the required elements of a case, and everything that I talked about today in our WellSky entries really can be captured from that form if it's completed. And the programs that do this well know that if they get a volunteer report with a case reported that doesn't have all these elements, or they see something that isn't making sense, that doesn't match with the complaint code that the volunteer selected, they call the volunteer and they talk about it. And sometimes with a little bit more explanation from the volunteer, the code they chose makes sense, or it might be changed. You need to fill in the details that are missing so that you can report a complete record. So here are those bulleted elements: the date that is received and the date the case is closed. The resident's name needs to be there. If it's someone other than a resident, the complainant's name and their relationship to the resident. Who gave consent? What is the complaint code? A description of the complaint and what the ombudsman did to resolve it. There has to be justification for why the ombudsman is reporting this as something the ombudsman worked on. If it's referred, we need to know what agency it was referred to. Often that's going to be long-term care regulation. Whether the complaint was verified is a question on the form, and the disposition of the complaint, and that's those three elements: resolved, withdrawn, or not resolved. So following the activity report form, which every volunteer is required to use, and the optional case record form, all of these elements are collected, and it is your responsibility as a staff ombudsman who supervises a volunteer to make sure that that entry is complete, or it shouldn't be recorded in WellSky until all those details can be collected. It's time for me to transfer over to Sarah, and so I will say goodbye to you, and we'll be back for Q&A.
Sarah, you're on mute.
Thank you. Hi, everyone. I was just practicing. I wanted to make sure everyone was listening and paying attention. I am Sarah Kimber, your Ombudsman Nursing Facility Specialist, and we thought it would be helpful for everyone to see another case example. So Patty, you can go to the next slide. And I am going to show y'all a discharge case in WellSky, and I'm going to start with good documentation. And so you see here, just briefly, we have a celebrity here, Betty Boop. She's calling in. She is Charlie Boop's wife. He is a resident, and she's calling, and she got a discharge notice in the mail. Mr. Boop is being discharged for non-payment, and Mr. Boop wants to appeal the discharge notice with your help. So I'm going to switch over to share my screen so we can go back into WellSky. And I've already made it large. Can y'all see that enough? Is it large enough to see?
Looks
I
good
think
to
so.
Okay, fantastic. Looks real big for me, so looks good. The first thing I always think of is, can I learn the resident story from WellSky? So can we learn Mr. Boop's story? So Alexa told us earlier in this presentation that when we're doing documentation, we need to make sure we're documenting the intake summary, consent, verification, actions taken, and disposition. So I'm going to go through all of those. First thing I want to mention here is my reference title. It says 30-day discharge notice. That is great. It's really exact. I know exactly what's going on from looking at the title, and my intake summary here, we can see how I got this complaint. So I clearly got this complaint from Miss Betty Boop, and she called and she said she got this 30-day discharge notice in the mail for her husband. So I already know here that the way I received the complaint was over the phone. I know it's not from the resident. So I clearly stated I gave her education about our program, and I asked her specifically, could I disclose to the resident, to her husband, that she contacted our program for assistance. And so she consented for me to reach out to her husband and share with him that she was the one that called. And the reason why I put this in here specifically is because sometimes we know we get family members or maybe other people that call, and they don't want the resident to know that they're the one that reached out. And so I'm going to keep that confidential, but I'm going to reach in with the resident and see if they want our assistance. So I'm going to jump down here first to the journal entries. And wow, would you look at that? I've got 8 journal entries. And, this is probably something that you are going to see if you have a discharge case, because there's a lot of things that you're probably going to need to document. So these are going to be really, Patty likes to call them meaty cases. We've got a lot of meat in there, a lot of things to chew. So first and foremost, I'm going to look at this first journal entry, and we can see it's call with resident. So I spoke with the resident over the phone, and he clearly told me that he didn't want to leave the facility. He doesn't know why he's being told to leave. And he asked that the ombudsman visit in person because he has a hard time speaking over the phone. So we know we need to make a visit here. And the resident would like to appeal the discharge with our help. And he also provided us consent to speak with his wife. So here I've kind of documented multiple things that's helpful for me to know. I know now that I can speak with the wife and share information about what's going on. I can, I've got consent here from the resident. I know what the resident's wishes are. So already I've got a lot of information to go off of. And we can see my next journal entry here on the 4th. So I actually went and made a facility visit. And here I've got a very long journal entry with all the information that happened during that facility visit. So what happened when I went? I visited him in person. He told me again he wants to appeal. He signed the 8625 discharge form, and I even made a note here that it's in the attachments. And so we're going to look at that in just a little bit. So I spoke with him, I got his wishes, and then I'm also making a note to talk about who else did I see when I was there. I spoke with a social worker, Miss Busybody, and she stated that she already had worked out a discharge plan for Mr. Boop, and that was to return home with his wife. And now you and I both know that Mr. Boop already said he wants to stay at the facility and appeal. So I explained to her what his rights were. I let her know that I was filing a discharge appeal, that he doesn't want to leave the facility. So I've clearly stated what he wants. And I also spoke with the BOM, the business office manager, Mr. Moneybanks, and he stated that he was new to his position. He wasn't even sure if a Medicaid application had been sent. He tried to locate the application in his office, but he couldn't find it. So we might be able to see here, this could be the problem, right? They don't even know if the Medicaid application has been submitted and they're already discharging the resident. So I also put a note here that I obtained the resident's records for the evidence packet. That's really important. And if we just jump down here now, I see that in activities, I do have a facility visit for complaint only documented on that day, which we clearly described in the journal entry. I'm going to click on it and go into it and see what this looks like. So we can see here that I talked to one resident, I talked to 2 staff members. That was clearly delineated in my journal entry. I've got the location going down here. I did write an activity comment. It was not as in-depth as what I put in the journal, but it was just to say, hey, this is what happened, this is what I did. And I even said, see journal entry in case number for further detail. That way, again, you don't have to be doing 2 things at once in 2 different places. This is just to talk about what happened at that activity during that facility visit for complaint only. So I'm going to go back really quickly to journal entries. I'm not going to read through all of these to save time, but if we look at just the subject emails here, we can see, the subject line, we can see I've got emails posted in here with the Medicaid Ombudsman's office. So I'm checking in to see, did this resident ever even get his Medicaid application filed? Because I'm trying to figure out what's going on. And you can see here, I also submitted an appeal form to the hearings department. We know the resident wants to appeal, so I made sure that I put that into a journal entry. So I've got evidence if I ever need to go back and say, hey, what day did I submit that appeal form? It's in here. I also have a note here that says see in attachment. So I clearly have an evidence packet that's in attachment, so I'm going to make sure that's there. I've got emails with the business office. I've got emails with the admin, and I always mark is what my time spent is doing. Am I using it for complaint investigation, or am I using it to reach a resolution? I make sure that my dates are correct. So I've got a lot of things going on in here, and I'm going to just click down really quickly to attachments, because I know I said a lot of times in these journal entries, see attachments. I want to make sure they're really there. So this is something that is really important, making sure you have them. Your file names make sense. I always make sure that on my desktop, I change the file name to make sure when I'm uploading it at WellSky, it makes sense. But I also make sure that my description is a good description as well. So we can see in these attachments, and if you're having a discharge case where you're doing an appeal, you're probably going to have a lot of attachments. I've got the 8625 discharge form here. I've got the discharge notice from the facility here. I've got the evidence packet I said I had uploaded, and I also have the fair hearing notice here. And so what I do, sometimes when I upload mine, I make sure that I click on them. I make sure that I uploaded the right file from my computer. So, oh wow, this really is a great evidence packet. We can see that. Awesome. Just verify that you are uploading the correct documents and that you're uploading the most recent documents. If you've had like maybe several different versions of something, that way somebody else can go in there and see what is the most accurate. So we've got a lot of attachments. That's fantastic. We've got our activity. We've got all these journal entries. I'm just going to go quickly here to the closing of the case and see, what happened. So I spoke with the resident's wife over the phone. We know she provided some missing bank statements to Mr. Banks, which we know is the BOM earlier. And I explained that the administrator stated that they would rescind the discharge letter, and that there's not going to be a hearing. I didn't go over that with you, but I've got a journal entry right here that talks about that with the emails in here. It's very important to get those emails documented in journal entries, especially if we're rescinding a hearing notice. I advised her to contact me if she ever gets another notice in the future. So one of the things that I wanted to share about this case was that I'm going to be closing it once we know that the Medicaid application has been submitted and we know that it's pending. At this point in time, we don't know if it's going to be approved or not, but the admin has already said, hey, we're going to cancel the discharge. They can stay for now. We know that it's pending, and I'm going to close it. I'm not following through all the way to make sure the Medicaid application got approved yet, because at this point in time, we know that the discharge notice is no longer an issue. So I let Ms. Boop know. I spoke with the resident. I gave him all this information. He's super happy he didn't want to go through with the hearing. And I asked him permission to contact the hearing department to cancel the hearing on his behalf, and he agreed. And so that was the last thing in my journal entries, is that I put an email that I contacted the Fair Hearings Department, and I canceled that hearing. So I've got a lot of good information in here. When I look at my complaint code, I see that I picked the right complaint code, discharge. I see that partially or fully resolved to the resident's satisfaction was a disposition, and I verified, all that was in journal entries. So anybody who reading this would know that the resident was happy, he was satisfied. Anybody that was reading this that wasn't me would also know that there was a referral made to the Fair Hearing Appeals Department, and I did add that in there. And then I've closed my case here already. So that's all. That was quite a lot. What I'm going to do now is I'm going to ask you guys to take a journey with me to a bad case. And so let's just imagine for a second that Mr. Boop, his Medicaid did not get approved for whatever reason, unfortunately, and he got another 30-day discharge notice. So let's go through this bad case documentation, and I'm going to ask you guys to please type some answers in the chat box. So first and foremost, let's think, are we going to be able to tell the resident's story and what's going on from this? So the reference title, discharge problems. What does that mean? What do y'all think about that reference title? Discharge problems. Is that good? Is it bad? Greg thinks it's overly generic, unclear. Yeah, we can have a lot of problems related to discharge, right? Patty thinks it makes her think that he wants to discharge and can't. Yeah, right. We could interpret that a lot of different ways, and that's one thing you want to think of. You don't want somebody to be able to interpret your reference title another way. So I'm looking over here too at the date opened and the first action. Does anybody see a problem with the date open and the first action? First action date too far out. Yeah, way too long. If you open this on the 1st and you're saying you didn't do anything till Valentine's Day, that's 2 weeks. And we're looking at this intake summary. So the resident has just discharge problems. Again, we don't know what those are. And I'm really excited that the ombudsman is going to help, but that doesn't give me any information as to what kind of consent, who gave me consent, where did this complaint come from? Did it come from Betty Boop again? Did it come from the resident? How did we learn about it? Were we in person? There's so much vagueness to this intake. I just don't know. Now, I've already kind of told you guys the backstory, so you know what the issue is. You know that Mr. Boop has got another 30-day discharge. So when we look at this complaint code, what do y'all think about this? Is this the right complaint code? Billing and charges. Now, when I look at the complaint code and I read this description, yeah, it's not correct. The complaint code for billing and charges says incorrect or improper billing, such as overcharging, raising rates without notice, deposits not refunded, and billing for services or supplies that were not provided. So this doesn't have to do with discharge. Now, we know that maybe Mr. Booth hasn't paid, but that's not the right code. So make sure that you're really reviewing the descriptions of these codes so we pick the correct one. Okay, and I'm gonna finish it up real quick. We can just see, look at these journal entries. I don't know what's going on. There's no subjects. There's only 2 journal entries. We see this one on the 14th, so I'm still worried. We got it on the 1st and didn't do anything for 2 weeks. We don't have a consent. Carrie said, that made my eye twitch. We've got no activities, so did I go to the facility? Did I not go to the facility? There's no attachments, so I can't even figure out, did Mr. Booth get a 30-day notice? Did he not? Did I appeal for him? Like, what happened here? So there's just not a lot of information. I don't know what the story is. And if we look at the last journal entry, okay, great, resident got approved, closing case, but did we solve his discharge problems? I don't know. And there's no way to know. And so what do y'all think needs to be in this case that's missing here? What else would you add? Just go ahead and type in the journal some thoughts and then we'll wrap it up. What else do we need? Look in here. Facility, we don't even have a facility name. We don't even know where Mr. Booth is. And how did we really resolve this, partially or fully, when we can't verify that with journal entries? So Alexis is everything. Perfect. Details regarding the ombudsman's actions. Exactly. We need to know what actions were taken. Okay, I'm gonna switch back over to stop sharing. Pass it back to you, Alexa.
Thank you, Sarah. Thanks, Patty. So we only have a few minutes left. I'm going to just briefly talk about a couple of situations that are complaints, but commonly get identified incorrectly as not a complaint. However, I do want you all to, if you have any questions, go ahead and type those into the chat box. So we'll make sure that we can at least see what questions you have and hopefully answer some in the just few minutes we have left together. So type away any questions you have for Patty, Sarah, and I. The first example of a situation that is a complaint, but sometimes ombudsman may mistake it as not a complaint, is if somebody calls with a complaint, but the resident disagrees with it. So you can see in this example, a son called about his father's care. He's concerned that his father isn't getting checked in on enough and just other poor care concerns at the facility. However, when you go out and visit with the resident says something to the effect of, "Oh no, everything's fine. My son worries too much. I'm okay." In this situation, that is actually a complaint. And Patty, next slide, please. You'll report this in WellSky. Your disposition in this case will be that no action is needed, and you'll still use your journal entries and the intake summary to explain what happened. Next slide. So this may be a little challenging for you to read now, but you'll have this in your handout if you need to reference it. It'll just shows you how to do an intake for a situation like this. Just to say how you got the complaint, what happened, and why you are choosing that this is a non-verified complaint and the disposition was no action was needed. But importantly, that it still needs to get entered into WellSky as a complaint. You can see even though it is not a complex complaint, it still even gets 2 of its very own journal entries. On to our next situation. The other situation that sometimes we see as not getting reported as a complaint, and we wanted to try and help clarify some of these more simple complaints that sometimes folks think that if it's not really complicated and if I'm not taking a bunch of steps, then I don't have to report it as a complaint. We're trying to say here that you do, in fact. So again, if it's a statement of dissatisfaction, by the resident and something that you assist with, it is a complaint. In this case here, you see that it's actually the resident's roommate who says that they want their bed to be made. The roommate sheets are soiled, and you ask the facility to get clean sheets for the resident. The roommate says the sheets are always dirty. Again, this is a complaint. In this situation, the resident's not able to consent, but the roommate let you know about a pattern of the resident having soiled sheets. You determine that even though the resident is not able to consent, you've got authority to investigate. Again, those details are in the Ombudsman Policies and Procedures Manual. You took the action of speaking to facility management, and you follow up with the resident to ensure the issue is resolved. So we're at time, but I'm not seeing any other questions in the chat box. So I'll just again point you to the example, the screenshots from WellSky here. Um, yeah, Carrie does make a point of I'll let Patty respond. Go ahead.
Oh, I was just going to say that I'm going to stay on if people want to ask questions. We'll keep the recording going. We know that people are going to need to maybe drop off and go to another appointment, but we'll just stay live with questions. So that was all I was going to say, Alexa.
Perfect. And maybe you can be ready to help me with this one from Carrie too, which does say, and we acknowledge that, you know, if we shouldn't not document for fear of it manipulating our resolution rate. We know that we all want 100% resolution rate, but it's not always feasible. So it's more important to make sure that we're accurately documenting the cases that come in. And if we're seeing a lower resolution rate on certain types of complaints, that's actually a really helpful data point, because we can say, look, we're doing everything that we can to address this issue X, Y, and Z, but we're not able to resolve these things. So maybe there's something deeper going on that needs to be looked at.
Thank you, Alexa. And a really important question from Carrie, and I am glad you asked it, because it's the reason why we keep telling you all we want you to think realistically about your resolution rates when you set those goals for your program. It's the reason why we thought 10 years ago that it was a problem that our state was resolving or reporting that we resolved 99% of our cases. I knew that was inaccurate, and our goal from many years has been to tell you guys, report what really happened. This is documenting your work should not be CYA and to make yourself look good. It should be an expression of what really happens from the resident's perspective. And just as Alexa pointed out, particular cases that we do well on, let's say we're rocking it on our discharge cases, which I would say we often do. It's so helpful to talk about. We've got so much detail in the nursing facility, Texas Administrative Code, and the federal regs that we can actually do things to help residents. Whereas when you look at another kind of problem like staffing, and we never get those resolved, if we had evidence that supported that we had staffing complaints that were unresolved, then we would have more evidence to point to and argue that we need staffing ratios and improvements in other staffing categories. So there's a reason why having bad outcomes is also useful information. Okay, so Melissa says, is there a definition of case versus activity? Yes. Melissa Ty, go into your Ombudsman Policies and Procedures manual, and you will see a definition of a case. versus a complaint. We just cover the complaint. And certainly activities are also defined. We have guidance from the National Ombudsman Resource Center, NORC, and they have a whole set of requirements for our casework, our activity work, what constitutes different kinds of activities. And so those are all federally explained, really. And then anything we've made as a special state activity like care plans that we collect, we've given you an explanation of what is a care plan and when would you document that care plan. And that's all explained in the Ombudsman Policies and Procedures Manual. So thank you for that question. Greg asks, when administrators call with a concern about a resident and we discuss our role in that situation, I usually enter that as information and assistance, an activity, and that would be information and assistance to a facility staff person. Unless the resident consents, and in that case, then I would open a case with the resident as a complainant. So this is an administrator calling and saying something's going wrong for a resident. Sarah or Alexa, do you have any concerns with what Greg is generally doing? It sounds like others agree they do this as well.
Yeah, so this is a great question because it's kind of tricky. So I think it depends on what the administrator calls you with. So if we think back to the definition of a complaint, which is a concern made on by or on behalf of a resident, if the administrator is calling and saying, gosh, this resident's so difficult, he's yelling at my staff, that sort of stuff, that's not really a complaint on behalf of a resident. So I think that's fine to give your role as the ombudsman and chart that as information and assistance. However, if an administrator calls you and say, hey, Mr. Jones is really having trouble with his Medicaid, the office hasn't been responsive, then that's a complaint on behalf of a resident, and that should be opened as a complaint.
Yeah, and I'll make even another example there. Even if an administrator said, I've got a resident who isn't taking his medications, he's refusing his medications, that might be a bit of a complaint more about a resident, but it could potentially be a case, as you say, if the resident identified there was a problem and wanted you to work it as an ombudsman complaint. So, you know, you're going to have to tease out those details, but I think your judgment seems really sound, Greg, and it sounds like others are seeing and evaluating similar circumstances. We will stay on for any other questions that are coming through. So if you have a question you'd like to ask, we'll wait a couple more minutes and see if there are any other things you'd like to talk about. What about things that we showed you in our records today? Did you have anything as we kind of had to push through those? Is there anything you'd like to ask a question about in terms of the practices that we're demonstrating to you today?
And Patty, while we're doing that, maybe I'll put this last poll on for people to
Great.
respond to. This last one will ask you to, I guess, basically kind of rate us now and ask you how confident that you feel that you can, you've absorbed what we've talked about today and you can put that into practice.
Oh, Melissa asks another question. If we could give guidance on the review date, and both Sarah and I skipped over that, and purposefully. And so Melissa says she's had mixed information on how we're supposed to use the review date. So the review date is immediately under the open date of a case record and your first action date. There's a place for review date. And in fact, that time frame is set by a little setting inside WellSky for each staff ombudsman user. You may not know it. I set it for 0 days. It's automatically set for 30 days in the future. The review date is a process we don't require you to use. It is something individually you can set that may help you if you want to set some routine time that you want to remember that this case needs to be looked at again because it's still open. Then you can have that case pop up in your list of items to review or cases to review. So your setting is set by you in a configuration link inside of WellSky. If you don't know what I'm talking about or how to do that, we can remind you how to do that. It's a little button inside WellSky configuration, and then you can set that time. So if you like the idea of 30 days being your review date, you can. If you want to get rid of it, you can. Like me, I put it as 0 dates and it just zero, and it automatically just puts in the day's date that I opened the case. You could put it for 45 days or 60 days. You can set a time frame that would be most helpful to you. Carrie says, she's mentioning, she says that I mentioned looking at that 15-minute increment of time in the journal entry. In my case, that email, I didn't choose to put a time spent on that email because it just took less than 5 minutes for me to do. And so she wanted to know why I mentioned 15 minutes. So there is no specific standard that we've set for you all before, and maybe that's something we can take a look at in terms of guidance for you. But 15 minutes is kind of a general standard of work study time. Time studies are done when they're looking at how much time I spend on an activity that's reimbursed by certain funds that we receive. And so, for instance, a Medicaid time study would look at what work you did at every 15-minute increment. So in the world of kind of government work, 15-minute increments are often used as sort of a basic standard of what's a reportable time activity. You certainly can use other time frames, 5 minutes, 2 minutes. If you want to document every minute that you've spent on a particular case, you could. I just use that standard for myself. If it's not 15 minutes that I spend on it, often I will not report it at all, unless I want to document something like the length of a phone call that I have with someone. And in that case, I might be very specific. My phone system logs exactly how long I'm on the phone, so I might put a 6-minute call or a 17-minute call in there in my journal entry. So I hope that's helpful, Carrie, but it is not something that we require you to do only in 15-minute increments. It's more of a personal practice that I take. Cindy says it's helpful to be reminded to attach things in a case, and of course that was particularly relevant in Sarah's case for discharge. There are a lot of documents you submit that we need to have a record and put it all into that record together. But also remember that attaching things into a case record doesn't really replace the need to have an intake summary and often to have journal entries that describe what you've attached. At least an acknowledgement that you have attachments related to the case, something simple like that, so that there is a reference to other details being available in the attachments. You don't have to restate or summarize the details inside those attachments unless that is your only case documentation. Then you do need to make sure that you've got something in your journal entries that really does describe your actions taken. Melissa says that she uses the review date that we talked about a few minutes ago as a way to know when to close her case. So she finds it useful as a practice. And I do think it's a good idea to talk about it with your team and decide what's the best time frame to set for your review dates. Apples asks, is there a way to change the settings for deleting an attached associated activity? So I think Apples, the problem is if you accidentally associate an activity, you can't undo it. And that's caused some problems because then you have to come to us for help. Will you let me know if that's the problem you're describing? Okay, we probably could change it. I'll have to check. but I'm not sure we want to change it, but I do see the problem that you're experiencing. So let me take a look and run the traps of making that, allowing that, whether there is a way to do it, give you permission without broadening something, and see what kind of pros and cons there are with giving you that kind of permission. So that'll be, have to put that on hold. Thank you. Any other questions that I've missed, Sarah, Alexa?
You haven't missed any. You got them all.
Okay. Any other questions from the audience before we say goodbye and wrap up? Kim says that this has brought her clarity. It would be great training for an MLO that's new to the program. Well, we've recorded it, so good, I'm glad. And Sarah, to you, Kim really likes the silly names and the giggles that gave her, so thank you. Thanks, you guys. We're glad this was a helpful way to present the information, and we'll take it to heart to share this with others. I appreciate your help and for participating today. Thank you very much.